Hi there and welcome to the Yoga Therapy Centre. This video is about relieving knee pain. Okay, so a lot of us get a lot of pain in the knees. I've got some poses that will work around those areas, and the final pose will actually get deeper into the knee. So there's 4 poses, lots of different poses you can use, but I've picked these 4 poses because I've used these in the Yoga Therapy Centre in India. And I've watched them use these to get some really good results. So first of all, we've got to work out the knee pain. Okay, so if you can't walk on your knee and you can't put weight on your knee, obviously you need to go and see someone to get it x-rayed or an MRI or whatever it is to decipher what the actual problem is. Because if you've got a torn ligament that's quite bad, you won't be able to perform these exercises. So if you can't perform these exercises, you really need to go and see someone. But if it's knee pain, general knee pain, if you've had knee surgery and you're just struggling with tightness and swelling, etc., these poses will be absolutely awesome for you. Okay, so in conjunction with these poses, there's breathing exercises, which I've got a pranayama class up on the website. Always bring that in with these asana poses. Okay, so that's your therapy, is your breathing and your asana and yoga nidra. Okay, so there's a yoga nidra class up there. I'm also doing yoga nidra classes every week. So you're welcome to join that. Bring all those in together and you'll start getting good results. And there's also a little technique that I'll show you at the end on rubbing certain products onto the knee, which will help as well. So let's start with the asanas, the poses. So asana means pose. Okay, so I'll revert to asana a lot because I'm used to it. So asana means pose. So the first one we're going to do is Utkatasana. So Utkatasana, Utka is chair. That's why I have a chair there. And pose is asana. So what this is going to do is we're looking at strengthening the larger muscles around, okay? So the quads, hamstrings, glutes, okay? So that's really, really important to work on any pain in the knee. You strengthen those first. Once they're strengthened, you're going to be able to get a lot of less issue in the knee, okay? So chair pose is quite simple. It's quite a simple pose. And how it's performed basically is we're just sitting in a chair. So we just bring the feet together, toes and heels touch, and we sit in a chair. So this is the pose. We bring the weight into the heels and bring the arms up. Okay, so that is the pose. Knees together, and I'll show you that. So knees together, arms up, sitting in the chair. Okay, so just looking at that again. Sitting in the chair. Now, if the arms are too much coming up, you can place them there and just hold there, because what we're trying to work on for the knees is this area, bringing the arms up, lengthens through the spine. Okay, so that's the pose there. That's too much because sometimes your knees will stop you doing that pose. That's why I've got a chair here. Okay, so what I'd like you to do with the chair, if you need to use that, is bring your feet together and sit in the chair. Okay? Then what you can do is bring your arms up and then lift off the chair. So that's it there. If that's too much for the arms again and you just want to work the legs, all you need to do is bring the belly button in, come up and hold there. Slowly work the arms up if you can, because it's going to lengthen the spine, and that's what we're after. And you're right on the chair, so when you need a rest, you can just sit down and come back up. Knees together, feet together, weight in the heels, okay? Arms up, chin up, chest up, and then just sitting down, up and down. Eventually, you'll be able to move the chair out of the way and just come into the pose. So the best way to get into the pose is sit, bring the hands down so that gets your glutes really switched on. Feet together, knees together, arms up and look up. and that's chair pose. Okay, so that's the first pose, chair pose. The next pose is bridge. So bridge pose, there's quite a few different ways you can do it, but I just want to show you the two ways I think you should do it for this. And bridge pose is laying on your back. So we're going to lay on our back. Bend the knees up. Again, what we're trying to do is strengthen the glutes, hamstrings, and quads. Okay, so bring the shoulder blades together, really important to get the chest up. Chin towards the chest, lengthening the spine. Palms on the floor, feet hip width apart. Bring the heels up towards the buttocks and then just lift. What we want to do is switch the glutes on, so we're squeezing the glutes and just lift. Shoulder blades together, chin to chest, holding there. Keep pushing down through the heels and the big toe, lift. So that one there is good enough to start off with. And if you want to just continue with that one, that's fine. If you want to go further, get more switched on in the quads, hamstrings and glutes, we move into the next one, which is pushing up. This time we bring the hands underneath the body, shoulder blades together. Watch that sternum go up high now. And then we're just pushing the hands downwards, chest up, push through the heel, toes, squeeze the glutes and lift. If you've got tight knees, you might feel this in the tight knees. Keep squeezing the glutes, lift and hold and release. Okay. So those two poses are really good. So if you use this as a therapy session, these two poses are awesome. I would do chair pose for around about a minute, and I would do bridge for about a minute for the half one. And if you can get to the next one, do that for about a minute. But if you can't go to the next one where you grasp your hands, the second one, all that means is you do the first one again for another minute. Okay, so they're the two main poses that are going to get the glutes, hamstrings, and quads switched on. So now we're going to go deeper into the knee, okay, knee and hip, but knee, what we're working on. So square pose is a really good pose because what we're doing is we're manipulating the knee, okay? So that's what we're trying to do. So the first two is strengthening, coming this way, and then what we're trying to do is bend that way. So what you've got to remember is anything in yoga therapy, forward bend, backward bend, side, side, twist, okay? So that's what we generally work on. So with the knee, obviously we don't want to twist it, but we want to manipulate it so we can strengthen the ligaments around there. So square pose is a simple pose. I'm going to show you how to get in to the full pose. So bring the left leg under first, laying that flat on the floor. Then we bring the right leg over, stacking the shins. Now when you're not warm, your legs are probably going to be like this, and you're going to know if you're going to be comfortable in this or not. If your leg's up here like this and this one's up here like this, there's another pose for that and I'm going to show you that. But if you're quite comfortable in here, then we're stacking the shins and then we come forward, okay? Start working forward. So that's working deep into the knee here. You're also getting a hip stretch as well. So if you want to learn to come forward, a bolster is really good, or a big cushion, like a big European cushion, and just lean on that and start coming forward. If you can stay in this pose, you have to do each side. If you can stay in this pose for 3 minutes each side, that's awesome. You know, work up to 3 minutes if you have to, but try and get there. If you can go past 3 minutes, even better. Okay, so working towards that, eventually you'll work towards this, and eventually you work towards that, and then eventually you work towards coming all the way to the floor. Okay, so that is the pose. A couple of ways to work with this pose. Number one, if your knee is up like that, but the other one is down on the floor, so your left one's on the floor, your right one's coming up, you can put a block or a towel. Towels are always good as well. you can roll the towel up and place it underneath there, okay? And that'll support that knee, and you want to work on bringing that knee down towards the floor, and you eventually release that and it comes down. Another thing that happens a lot is the bone on your ankle digs into the floor and it becomes really uncomfortable. So make sure you've got a towel around and you can just sit that on there. It happens to me quite often. And you might even get it in here in the calf as well. And you can have the towel there and you can place that there, and it's a lot more comfortable when it comes to that. You're not pushing a bone into the floor or into your muscle. Okay, so that to me is a comfortable way to get into the pose when you can do the full pose. Okay, so we're stretching the knee capsule, as you can see. We're blocking off the blood flow. That's one of the most important things for these next two poses. The first two poses, strengthening the larger muscles. Next two poses, getting deep into the knee. So we block off the blood flow. So once we finish the pose, you get fresh blood, oxygen, and nutrients pumping at a fast pace through that capsule. And what that does is get rid of all the excess junk that sits around there, which is just stagnant energy. Okay, so we try to push that through. And so that's why we get a really good release after poses like this. So that's when you come into the full pose. This is how we sit. And as I said, work you up to 3 minutes. If you can go over, that's awesome. When you finish, make sure you release carefully, stretch the legs out, allow the blood to flow through the knee and the ankle. Then work on to the other side. So right leg down, left leg up. Again, sides are different, okay? So you can work on, you might be up on that side, perfect on the other, or vice versa. So sitting here, working here, this is a little bit tighter for me today. So I'll just start coming forward. Or I might even use the bolster today and just hold into that area. I'm just gonna start releasing all the tightness that I have through my hip and knee. Okay, so again, you can use, under your ankle bones, use a cushion or a towel or something like that. So that's, again, the full pose, working forward, eventually working to the floor. So making sure you do either side for the same amount of time. Okay, so if that's way too much, how I started with that pose, there's no way I could have done that when I first started yoga. It took me about 2.5 years to cross my legs. So there was no way that I could have worked with that back then. So you've got to work your way through there. So left leg out first, bring the right leg up and place it as high as you can go. This is exactly the same pose, which is working to get that knee, because usually people, if they struggle, their knees up here. So we're working to get that knee on the ground. So if your knee is high up, that's okay. It's tight, okay? You've got to work with that. So place a pillow, cushion, something under there, and just start working down towards, working that knee down towards the floor. And again, this, to me, this is a little bit annoying because I'm pushing into that quad and it's not comfortable. So you can get yourself comfortable and then hold in this position. You can lean forward if you like. If you need to sit up and you want to sit up, that's fine. So that is the way you utilize this pose. Switching sides, right leg out, left leg up, coming into the pose. I feel better now on this side, so I'm going to come forward and you can work forward. And you do that until one day you can do that. Okay, so you just work towards that. Never push too quick to be in this position because you're not going to get the effect in the knees that you need. Okay, so tight hips, tight knees are going to cause you to sit like this. So that's when you revert to that. All right, just another thing, sometimes what happens is when you bring your knees in like this, you feel a little bit of pain in that knee. There's a couple of things you can do. I've got a strap here. You can use, you know, a belt or something, dressing gown, robe, tie is always good. You might only need a little bit, and you just place that under the knee, close the knee, and that'll give you some space in the knee. And that feels so much better even though my knees are okay. So that feels so much better. If that's not enough, you move to a towel and you can just wrap the towel up to however you need it. Place it under the knee, close the knee, and work in that position there. Just giving you space back in the knee until you start stretching all those smaller muscles and ligaments and tendons. And also, we're building up these bigger muscles. Once they build up, they're going to readjust with that kneecap and give you a lot more support. Okay, so that is square pose. Really, really important pose. So make sure you do your warm-ups first, which I call the warm-ups, which is Utkatasana and bridge pose. Do those two first, about a minute, minute to 2 minutes. However long you want to go, you'll feel when you need to not do those. Square pose, work up to 3 minutes either side. And then we're going to do the next pose, which is the bee's knees. It's the top pose to do on fixing knee issues. Okay, there's several ways you can get into this pose. I'm going to show you the full pose first, but don't just dive into it, okay, because you'll know if you can do it or not. So the full pose for this is what we're trying to do. I'll explain what we're trying to do. We're trying to lengthen the quad. Okay, so we're strengthening the quad with the other exercises. Now we're trying to lengthen the quad. Okay, so the quad shrinks over time, particularly if you do a lot of running or sitting for your job or driving a lot. It shortens, and what happens is the kneecap pulls upwards. Okay, so the patella moves up and the shin moves out. And what happens there is that causes all the inflammation and the pain problems around the knee, sometimes deep behind the kneecap. Okay, and in underneath the knee, causing a lot of tightness through. Okay, so to get rid of that, we need to block that area off. And then, as I said, get that fresh lot of blood pumping through that area. So Supta Vajrasana is the pose, or reclining hero pose. You come into that. I've shown it on plenty of other videos that you can watch, but this is perfect for knees. So coming back into that area and then working backwards. So the full pose is coming into, so what I'm doing is sitting in between the heels, knees towards each other, working my way back. This might be comfortable for you, but you can bring your head back, arms over, and into the pose. Okay, so that's the full pose. Then you come up and out of the pose. As soon as you're out of the pose, 3 minutes in that pose if you can. Flicking over and allowing that blood to flush through the joints. Okay, so that is Supta Vajrasana. So with square pose and Supta Vajrasana, make sure you have Shavasana in between, so laying on your back like I just did. So if you can't get into Supta Vajrasana like I did, and I was quite tight to get in there today, so I would probably back off a touch. There's a few different ways you can do it. So you can have a block or a cushion. Come into the pose here, sit the block underneath, and just sit in this position here. Okay, so feet are wide as you can see, and we're sitting in this position, and you can work your way back. You're going to get a nice stretch through that area. Okay, so that could be a comfortable way to start off with this pose. Eventually, you move the block, your hips come down towards the floor. Another good way is to set up something behind you that you can relax on. So if you've got a block and a bolster, they're really good to have. If you're serious about yoga journey and healing and helping yourself, get rid of a lot of these ailments. These two products and a strap are really, really important. So what you can do is you can just sit that there like that, bring your knees together, and come back into there. So I'm getting the stretch through there and just working into this pose. 3 minutes in this and just relax. Now, again, we can use this if I'm feeling anything under my knees, any sort of pain, anything that's that's stopping me from going back, you can use a strap and place that under, and that takes away that lack of space that's in your knee. So it's giving you space. Or you can use a towel. A towel's always really good. I recommend a towel for most people. And you can just roll it up to the thickness you like. You can place the towel under both knees if you need to, or if it's just one. Place it right up underneath the knee, and then just sitting back. Another place people feel this is underneath their ankles, so underneath their feet. And what's happening again is just tightness in the ankles. And so what we're trying to do is give you space back. So roll that up, place it like that. You might need two, one either side. Come up and come back into that position. If that's not high enough, roll it up again, put another towel, put a blanket, whatever it is, underneath you, and then you should get comfortable. But take your time to get comfortable, because this is a very, very good therapy for the knees. Take your time to get comfortable, okay? And then you'll be right in the pose. Okay, so that's if you can go on both knees. A lot of people can't do that, particularly if you've got an injury. One knee might be good, the other mightn't be, so it's stopping you getting into both knees. So one leg at a time. Okay, so left leg straight out, bring the right foot back. Make sure that you've got the ankle this way, because we want to stretch through this ankle here. We want to really, really work this section of the leg. So you can be in this position, you can sit back, you can have the bolster behind you like I just did, or you can come all the way back. What you don't want is your knee lifting off the floor. If your knee lifts off the floor, whether it's one leg or both legs, come back up and just hold in this position. Eventually, you'll work your way back. Eventually, you'll get into two legs. Okay, so once you do that, if you're doing 3 minutes, 1.5 minutes either side, stretch that out, and then come into that. Get yourself comfortable in there. Again, you might need the strap underneath there, the towel. You might need something under the top of your foot to release the ankle tightness. So just work with all those sorts of things that I've just gone through there. Get yourself comfortable, go into the pose, get your watch, your clock or your phone or your watch, put a timer on and try and time yourself through there. So those 4 poses are awesome poses to get knee strength back. Release the pain and get your knee strength back. Knees are so important, so important. So just remember, on my website, I've got a pranayama breathing class. If you can utilize some of those breathing exercises after this. So once you do your asanas, do some breathing exercises, which is going to nourish the blood. Okay, so we're trying to get that blood to flow evenly through. What happens is when you've got an injury, the blood's flowing through, it comes to a block, okay? Stagnant energy stops the blood flow, stops the oxygen, builds up a lot of gas. All that sort of stuff is happening in that knee, and you think you've got this knee issue. So breathing is important, breathing. And so when you're in these poses, Ujjayi breath, restriction of the throat, Ujjayi breath. I've got a video on the breathing. Look at that and work with that breath. So they're the poses. The last thing I want to do is just grab something that I find hard to live without. And this is till oil or sesame oil, and it's pure sesame oil. Okay, so it's a clearer version of sesame oil. You can get this from a really good Indian, any Indian grocery store, they'll have this. It's quite cheap. You can get it online as well. There's a lot of different ones. This one's called Idhayam, so Idhayam. This is a really good quality one. I like to use this one. Using this on any joint pain, I can tell you it's amazing, or any dry skin or anything like that. I'll go through the Ayurveda stuff another time, but generally for Vatas, if you can look up Vata, if you think you're a Vata, this is perfect for. So what we do is we warm it up. I just put in a saucepan. It takes literally not even a minute to get warm. Make sure it's not too hot. And then you just pool it on the area. So make sure you've got towels underneath you. And you just pool it on the area. I'm going to do a video on this down the track a little bit. And so you just pool it on the area and then slowly rub it in. Make sure there's plenty there. And you just rub it into the entire knee. And just allow that to soak in, because sesame oil soaks into the skin the fastest out of any oil. Okay, so it gets deep in the skin. Okay, so with that, breathing exercises, those 4 asanas that I showed you, as well as yoga nidra. Okay, so yoga nidra is really, really important. I've got one on the website, and yoga nidra classes every week now, so make sure you access them, and I'll tell you more about yoga nidra on how the healing process works through that. Okay, so I hope all this is good for you. If you do have knee issues and you've got any more questions about what I've just gone through, make sure that you message me, ask any questions about that. But all this process, what I've talked about, is the therapy process. And the therapy process is the asana, the breathing, the meditation. Okay, yoga nidra is going to teach you how to meditate. That's what I love about yoga nidra. It's going to teach you how to get into that space. And this will all work if you use it on a regular basis. If you say, I'm going to do this twice a week, do it twice a week and just see the results. If you're going to do it 3 times, do it 3 times. Just remember, with yoga, once a week with yoga, it's going to give you a really good balance, and it's going to help you long term. If you do 2 classes a week, obviously it's going to double that. But if you do 3 classes a week, it's going to change your body. Okay, so your body's going to start being affected. Just doing yoga 3 times a week. You can do yoga every day. Mental and physical health. That's where we come to health and well-being being positive. Okay, so thank you again for watching this. I hope it helps. I know it'll help if you do it on a regular basis. Just remember to use the props. Everything that I've got here, utilize it and just work your way to get to the pose where you need to get to. And you need to fix these knees and look after the knees. So thank you again, and have a wonderful day. Namaste.